Lorna was an incredible physician and an incredible leader at New York Presbyterian Hospital, where she was running the emergency department at the Allen Hospital. Lorna was a salsa dancer. She was a snowboarder. She was a world traveler, and she was the crazy aunt to 8 nieces and nephews. She was always taking them places and having a great time. Lorna was very typical as a physician. In particular, was her fear for getting mental health treatment. And those really intense hours in New York City during days and weeks and months during the beginning of the pandemic, when the emergency rooms were overwhelmed with patients dying in the waiting rooms, clinicians who didn't know how to take care of them. Lorna contracted COVID, went back to work way too soon after being sick with COVID. Like within 12 hours of being afebrile, she went back in. She was way too debilitated from her COVID to provide patient care. But nonetheless, just like the firefighters on 9/11, she ran back into the burning building and it killed her. She pushed through with sleepless nights, already depleted, got herself into a position where her mental state was compromised from COVID and from the pressures that she was under. We, as a family, got her her first and only mental health treatment of her life down in Virginia. During her stay in the inpatient unit at the University of Virginia Health System, she began to articulate to us that now that she'd obtained mental health treatment as a clinician, her career was over. Everything she'd ever wanted as a child was done. At the time, I was the CEO of the University of Virginia Physicians Group. I was a lawyer by background. Her little sister Jennifer was my wife, also an attorney, and we were trying to really explain to Lorna that because of the Americans with Disabilities Act, she didn't need to worry about those kind of things, and yet she could not be moved off of that position, and ultimately died by suicide just a few days after being discharged from her first ever mental health treatment. Our family wanted privacy in that moment of deep grief and shock. But that privacy was ripped from our hands by a national paper news outlet that published her cause of death over our objection 12 hours after she passed. In retrospect, that was a gift. At the time, it felt like the biggest gut punch I'd ever received. Certainly was not something that was welcome. At the time, because Jennifer and I were so concerned about health workers, we felt like it was important to warn the country that other health workers like Lorna were at risk of contracting COVID and then coming back too soon and potentially having the impacts of COVID on their cognition, and just we needed to protect them. And so we started to share Lorna's story to highlight an incredible woman who gave everything of hers and died at the age of 49 because of the workplace conditions that she was working in. When we began to speak out, and frankly, after that initial news coverage, then a flood of feedback came to us. And that feedback did not relent for 3 years. Every day we were hearing from people that we didn't know the day before. And after hearing from that initial flood of feedback for about 4 months, we said, okay, we cannot ignore this. We need to do something for the healthcare workers who are left behind. We named the foundation after Lorna, but the foundation isn't for Lorna. It's for all the health workers in the United States